recently I saw an article from ProPublica, which is a nonprofit organization involved in investigative journalism. You can go to propublica.org. The title of the article was "Early Data Shows African Americans Have Contracted and Died of Coronavirus at an Alarming Rate." The article was written by Akila Johnson and Talia Buford. What they reported is that unlike sex and age, a racial breakdown is not often provided when we're talking about those affected by the coronavirus. One such place that is providing a racial breakdown is Milwaukee, Wisconsin. As other places, other counties in other states, there's a daily report of those confirmed cases. And as of today, April the 6th, 2020, there are 1,270 confirmed cases of the coronavirus in Milwaukee, Wisconsin. 579 of those are among blacks, 296 among whites. It should be noted that for 354 cases, race was not reported. Likewise, in Michigan and in Illinois, the same type of breakdown is being seen. The most commonly affected age group, 50 to 59, the most commonly affected sex, female, the most commonly affected race, black. This is of particular note in Michigan, where blacks comprise 14% of the population, but represent 35% of the confirmed COVID cases and 40% of the deaths. In North Carolina, the age group tends to skew slightly younger, with the most commonly affected age group being 29 to 49, females being the most commonly affected sex, and whites being the most commonly affected race. However, even in North Carolina, where the African American population is 20% of the population, they represent 37% of the confirmed COVID cases. And in those places where a racial breakdown is not publicly shared, it's been noted that in those places, such as New Orleans, 40% of the deaths are coming from predominantly black parishes. In Philadelphia and in New York, more cases and more deaths are being identified among African Americans and in predominantly black communities. What is interesting is that the CDC has not been providing a racial breakdown of affected persons. And the question is, at a time like this, does race matter? Apparently, the Milwaukee Health Commissioner thinks so and has declared racism as a public health issue. We live in a country where there are obvious health disparities such as maternal mortality and asthma. And the question is, why? Is it because blacks have a higher morbidity and have higher numbers of chronic conditions? Or is it lack of access to health care? Or is it not being valued as a human being in the healthcare system? Or is it all three? The CDC has been petitioned to start providing a racial breakdown moving forward. We shall see. In the interim, kudos to the two female journalists who produced an excellent article, and kudos to the health commissioner in Milwaukee. Examples of black women rising.